if you're involved in sport, anything could happen. I was born and raised in Perth, WA, and I moved over to Canberra about a year ago. I always wanted to move somewhere on the east side of Australia just to be closer to sporting hubs because that's where I wanted to work. I was introduced to touch football in primary school, but I wasn't more involved until about 2013 when I was in uni. That was one thing that I was really excited about coming to Canberra, was actually playing touch football. In 2014, I had just collided into the person, clicked my knee and had just completely fell down. And that was a full rupture of my ACL. The second time I did my knee, it was 2018. I was playing touch football again. It was a bit more of a rough push from someone. I was pushed off balance and I felt the same sort of clicks in my knee. But that time I didn't really know as well if I had done it, so I actually kept playing the second time round thinking that it was okay. I found out later that it was a bad tear as well. It affected a lot of different areas of my life, even just socially and with work as well, and affecting my university studies too. Going with private health was a good thing for me because it was a good way for me to decide when to actually do my surgery and to be in somewhat control of those controllable areas. The first time I did it was around the time that I had exams, so I was able to sit down with the surgeon and say, well, I'm free after this date, can I please do it at this time? And it was easy to schedule that particular date. And then the second time round, it was very much more of a rush because I was starting a new job in a week or two, so I went in to see the surgeon on a Monday and 2 days later he said, yep, we can do your surgery. My rehab, it was very much just going to the physio and following the exercises. This time round I've been going to the physio more often, and I have been part of an 8-week program to help me return to sport as well. Slowly it's feeling a bit better. The first few times I went back to bouldering, the biggest issue was falling off the wall. There was a lot of climbs that I wouldn't do because I was unconfident, or I felt that if I slipped I would fall and then I'd hurt my leg again. Both times I injured myself. It wasn't completely something I could control. What's next for me? It's getting back into touch football where I can, trying to get back to the level that I was at prior to injuring myself.